Menopause is a silent struggle, and breaking this silence is crucial for women's health, equality, and economic growth. World Menopause Day serves as a powerful reminder that it's time to bring this issue into the spotlight. And the benefits are far-reaching. The impact is staggering. Over 450 million women worldwide are currently going through perimenopause or menopause. And addressing this health gap could result in 2.4 million disability-adjusted life years saved and a $120 billion annual GDP boost. But here's the catch. It's not just about the numbers. It's about improving the quality of life for millions of women. The challenge lies not in the lack of need, but in the lack of preparation within the systems that support women. Late, inconsistent, or inaccessible diagnosis and care are common, with studies showing that while 60% of women with significant menopausal symptoms seek treatment, 75% remain untreated. This is partly due to inadequate training, as many healthcare professionals receive minimal education on menopause. And this is where it gets controversial. The impact on the workforce is significant. Research reveals that 1 in 4 women considers leaving work during this transition, and 1 in 10 who continue working eventually quits due to symptoms. This isn't just a productivity issue. It's about lost opportunities and the departure of experienced leaders. But there's hope. Organizations like the World Economic Forum's Global Alliance for Women's Health and Halle Berry's Respin Health are leading the way, translating science into actionable solutions and policy changes. A powerful voice Halle Berry emphasizes, leaving women to navigate menopause alone has severe consequences for health, productivity, and dignity. We must normalize menopause conversations, provide practical guidance, improve access to quality care, and invest in research. Primary care should integrate menopause as a routine part of women's health, offering screening and clear paths to counseling and treatment. Evidence-based approaches include lifestyle changes, non-hormonal treatments, and informed hormonal therapies when suitable. Mental health and cardiometabolic risks should be addressed, as they often accompany menopause symptoms. Workplaces can make a difference with simple adjustments. Flexible schedules, paid time off for symptom management, and practical measures like temperature control can significantly reduce absenteeism. Benefits packages should explicitly mention menopause coverage, and manager training should normalize support without compromising privacy. Research and product design must bridge the data gap and set higher standards for solutions. Studies should represent diverse women, and endpoints should be comparable to ensure effective treatments. Digital tools and consumer products targeting menopause symptoms should be evidence-based and affordable. Policy and financing play a pivotal role in making best practices the norm. Menopause services should be included in national health packages and insurance coverage. Governments can incentivize employers to adopt menopause supportive policies, while public campaigns can replace stigma with understanding. The impact extends beyond the individual. Prioritizing women's health leads to healthier families and stronger economies. Early diagnosis and proper treatment reduce absenteeism, while supportive workplaces retain experienced talent. The benefits are twofold: improve in national productivity and, more importantly, enhanced quality of life for women, marked by better sleep, clearer thinking, and restored confidence. Advocacy is most effective when it combines public leadership, technical expertise, and coordinated action. Public figures, researchers, and clinicians work together to define quality care, while cross-sector forums align employers, health systems, and governments on practical standards. The path forward is clear. Health systems can integrate screening and counseling into primary care. Medical education can be strengthened, employers can implement menopause policies, researchers can design inclusive studies, and policymakers can ensure menopause care is covered. But it's not just about policy, it's about cultural change. Partners, friends, and community leaders can play a role by listening without judgment and sharing experiences. World Menopause Day should be a yearly call to action, asking if we've made it easier for women to access information, care, and support. The answer lies in our collective resolve to create a supportive environment for women's health and well-being.